My daughter Gemma was diagnosed with pancreatic cancer in April 2010. She was 26 years old when she first went to her GP, and she went because she was suffering from some vague abdominal pains, and between the April and the September of the same year she ended up going backwards and forwards to her GP on at least 10 separate occasions.
For my dad, the only symptom that he showed for the best part of 6 months was lower back pain. Unfortunately, for most people, lower back pain doesn't warrant going to the doctors, and that was certainly the case with my dad.
I was experiencing stomach discomfort, pain, and I booked an appointment with my local GP. He was thorough, got me on his bed, examined, prodded, poked my stomach area, but felt I'd pulled a stomach muscle, which I suppose for me, you're glad to accept a simple solution.
Each time she was told that it was something different. So she was told it could be IBS, she was told it could be gastritis. On one occasion she was told it was probably stress.
Towards the end of the journey, I guess, he showed signs of weight loss and jaundice. But of course, when the symptoms of jaundice appeared, which resulted in him being diagnosed with pancreatic cancer, it was too late.
When I came back from the local hospital, having been told I got the shadow on the pancreas, we were all in tears, all crying in my lounge. My older daughter was pregnant at the time, and I'm saying to her, you mustn't cry, you've got to be happy, we want a happy baby. But I had this terrible fear in me, would I even see the baby? Thankfully I was found to be suitable for surgery. Here we are today, so I'm grateful.
Once they'd said there was nothing they could do, that actually meant nothing in terms of chemotherapy, radiotherapy, certainly no surgery. She was diagnosed far too late for any of those measures to be put in place. Here was a 27-year-old by then who, instead of facing a wedding, which she should have been that year, she knew she was facing her death.
The first ask for MPs would be to raise the profile as much as possible throughout their constituencies, and in particular with the public and with health professionals.
We need the government to provide more funding to try and develop some early test to detect pancreatic cancer. If we can detect it early, we can get more people operated and more people can hopefully survive for a bit longer.
Pancreatic cancer is one of the biggest killers of all the 20 common cancer types, yet the funding it receives is minuscule in comparison to other cancers where the survival rate is 80+%.
Everybody just needs to totally make sure this cancer has a higher profile on all levels, and the early diagnosis is addressed as a matter of urgency. I know that if Gemma had been taken more seriously, if there had been an earlier intervention, she may well have been here today.
Roy's story shows symptom awareness and early diagnosis are essential to survival, yet 3/4 of people do not know a single symptom of pancreatic cancer. Raising awareness of symptoms could help more people get diagnosed earlier. Symptoms of pancreatic cancer: abdominal pain which can spread to the back, unexplained weight loss and loss of appetite, jaundice, yellow skin or eyes, oily floaty poo, indigestion. The APPG on pancreatic cancer is calling on the government to take action against this deadly disease. Join the movement to improve diagnosis for pancreatic cancer patients. Find out more and read the inquiry report at pancanappg.org.uk.